Today we will discuss about health history. In health history, we have two types of health history: focused health history and comprehensive health history. In comprehensive health history, we will go as a traditional basis from head to foot assessment as well as the past and present socioeconomic status, family history, and other types of history. Whereas in focused health history, we will be focusing only on clinical conditions, why the patient got admitted right now, for what purpose the patient got admitted right now. On that basis, we will be going for the focused problematic basis. We will be collecting the health history. This focused health history will be much useful in the casualty area or in the intensive care unit, where a physician or a nurse need to take care of or attend the immediate care of the patient and to implement the nursing care as per their thing. The comprehensive history includes identifying the data and sources of history, chief complaints, everything. There are various guidelines to collect the health history. So we need to provide and comfortable and quiet environment to the patient and the relatives. Allow the client to state the problems and expectations for the interview, what you exactly expect from them. Allow them to speak and orient the client or the patient the structure, process, and expectation of the history. The other guidelines, which includes communicate to the patient and negotiate the priorities. What is the priority that you would expect? Maybe the patient is suffering from chest pain. So what, when the chest pain had been started, what is the characteristics of the pain? That is what we expect. Tell the patient, negotiate with the patient what you expect. Listen more than the talk, which means allow the patient to talk more than you try to be listen what and all they are expressing to you. Observe non-verbal communications of the patient, especially body language, voice tone, and appearance. The other guidelines, which includes review the information about the past health history before starting an interview. That is most essential. What are the past problem that the patient has? Always balance between the allowing a client to talk in an unstructured manner and the need to structure requested information, which means maybe you can allow the patient to talk unstructured basis, though they talk unstructured unwanted answers they give. So you try to balance as a nurse and a physician. We need to balance between unstructured and structured request which we need. Avoid yes or no questions. Always get a give an open statement to the patient so that they can elaborate or enumerate on their own. Write adequate notes after collecting the health history and record the history as after the interview with the patient. There are various components of the health history. The first component is patient profile, which includes full name of the patient, address, gender, religion, marital status, occupation, date of admission, what is the clinical diagnosis, name and date of the surgery, what is the if for example if the patient underwent surgery means we need to mention which post-operative day. So the clinical diagnosis may be acute appendicitis, name of the surgery would be appendectomy, if it is in laparoscopy appendectomy or laparotomy appendectomy, post-operative day, which may be 0, which has been conducted today, or it may be POD 1 and 2. This is how we need to write the patient profile. Whereas in chief complaints, what is the reason for hospitalization? For example, patient had come to you with the chest pain. How many days or when the chest pain had been started? What is the reason? Maybe when they lift, they started the pain, or swollen ankles. When they swollen ankles, they have observed for 2 weeks, or they come with the fever. All such thing we need to assess from the patient. That is how we need to ask. That means which is patient present history. Here the present history goes about what is the chief complaint that described by the patient. Pain or headache or chest pain, ankle swelling, whatever it may be, fever, all such thing, which includes thoughts and feelings about the illness. Everyone perceive their illness on their own, which may be unique in nature, each individual. So accordingly, we should collect the history from the patient. Always pull the relevant portion of review of system, which means concentrate on cardiovascular system and respiratory system if the patient is suffering from chest pain. And other things may include whether the patient had developed allergy after taking medicine, or patient has any habit of smoking, or after alcoholism the patient had developed symptom which are frequently pertinent to the present illness. So we need to ask for any medication they are taking, any allergies they have, any habits of smoking they have, all such things. Then about the past history, what is the list of childhood illness that has to be done in the past history? List the adult illness which with dates and at least four categories. That means medical history, medical past history, surgical past history, obstetrical history, and psychiatric history. Example would be for the medical history is diabetes mellitus and hypertension, whereas surgical history, mother would have undergone lower segmental cesarean section or puerperal sterilization or appendectomy, which may be very common, or hernioplasty. Obstetrics or gynecological history, again they would have undergone for total abdominal hysterectomy or anything related to obstetrics and gynecological history, or they would have gone to any other thing like polycystic ovarian disease, a CA ovary, CA uterus, and they are on treatment, anything obstetrics and gynecological history for women. And as well as the psychiatric history, or they experience any depression, anxiety, were on treatment, or any other non-medical management, which has to be included in the past history. So these four categories should be mentioned under the past history apart from the childhood illness. This includes the maintenance of the practices such as immunizations, screening tests, lifestyle modification, home safety measures, what and all they have. Home safety measure, they have asthma, and they have nebulizer very frequently with oxygen supply. They have heart failure. Immunization schedule had been completed. Screening tests such as pap smear, they are going for regularly, mammogram, all such thing. Or any lifestyle modification, low salt diet, low diabetic, and they take a low carb diet, all such things should be included in the past history. In family history, so we should mention the family history about the any of the parents is suffering from any of the illnesses such as hypertension, coronary artery disease, diabetes mellitus, and cancer, all such things should be mentioned under the family history. In personal history, in this, it is related to the habits of the patient, whether they are known smoker or alcoholic, all such things should be mentioned here. Apart from this, we need to mention about the socio-economic status of the patient, where they live, urban or rural area, or type of the house, and all the sanitary facilities, electricity and water facilities. This should be mentioned under the socio-economic status. Apart from that, we need to mention who is the breadwinner of the family. Under the family history, try to include the family tree for the three generations. Under the personal history, you try to include what is the habit of exercise, intake of water per day, maybe 7 to 8 glasses. All such things should be included in the thing. So apart from this, taking an comprehensive health history, a nurse has to include the system-wise observation on the patient, that is head to foot assessment, and document it properly. So that is what I mentioned about the socio-economic status. Current health information. So how about the current health information? Allergic to the ingestion of the food or medication, or environmental dust allergy, all such things. Habits include alcohol, tobacco, drug, and caffeine. Medications which they take regularly apart from the doctor, or they take regularly with the doctor's prescription. These all should be, and sleeping pattern. These all should be listed under the personal history. And this just mention about the whether they are sedentary worker. Physical system assessment. So assessment of the that means physical examination of the patient is a general physical assessment. So we need to concentrate on assessment of the skin, assessment of the respiratory system, cardiovascular, gastrointestinal, urinary, urinary tract, and extremities. These are all the systems should be assessed in briefly, and concentrate only on the affected region. Or for example, chest pain means concentrate on cardiovascular system. In general physical assessment, we need to observe the skin. So, which means hint, Heent, head, eyes, ears, nose, and throat. Head, observe for scalp, any dandruff, another thing. Eyes, whether the patient is anemic or pale of conjunctiva, yellowish discoloration of the sclera. All such things should be observed on eyes or any opacification of the lens. Ears, cleanliness of the ears, and how about our hearing capacity. Nose, any sinus problem, deviated nasal septum. Throat, enlargement of the thyroid gland. All these things should be observed. Hint, HEENT. And whether they use glasses or hearing aids, all such things should be noted in the physical assessment. Apart from that, in the mouth, you need to assess the patient for any dentures they use. In the neck, observe for lumps, goiter, or any pain in the thing. Respiratory system, ask for history of any shortness of the breath, wheezing, any cough the patient is suffering from. Especially to cardiovascular system, we must concentrate on heart rate, I mean pulse rate and blood pressure taken recently, any history of dyspnea, orthopnea, chestpnea, chest pain, palpitation, has ever had an ECG because of chest pain. Related to gastrointestinal system, how about their appetite? Whether they have a problem of nausea, vomiting, and problem in indigestion, bowel movements are regular or twice a day, once in a day, especially diarrhea or bleeding. Some people would have not even mentioned about the bleeding during defecation, maybe due to hemorrhoids. Because of that, they may go for anemic condition, which is not treated. And even a patient has a history of alcoholic will have a liver problem. All such things should be notified. Urinary system, ask for dysuria, frequency of urination, hematuria, that is blood in urine, any pain in the flank region where the patient have urinary colic will have a pain in flank region, nocturia, whether they go for urination in the night once a day or a large volume occasionally loses the urine and may cause a dehydration. Peripheral vascular system, assess for varicose vein for both legs, any pain they have, phlebitis they have, leg pain they have, all such things should be monitored. Musculoskeletal system, whether they have pain, back pain especially, you need to observe for that, whether they do regularly exercise or yoga, walking, they have practice. Any psychiatric illnesses like any depression or anxiety, all such disorders, they have undergone for any treatment or non-medical management. Neurological assessment includes any history of fainting, seizure, motor and sensory loss, and whether their recent and remote memory is good. You ask for their patient birthday and ask for how many children's. That is for recent memory. You ask the patient what they had breakfast, that they had a good sleep in last night. Hematological, any bleeding from the gums, all such things you need to ask for it. Endocrine, when enlargement of the thyroid gland, sweating excessively, whether any symptoms of diabetes, polyphagia, polyuria, and polydipsia. These symptoms should be asked from the patient. Apart from that, we have a comprehensive this is about the comprehensive health history, whereas the focused health history, we need to go about sample. Sample, which means S stands for signs and symptoms from the patient, A stands for allergies of the patient, M stands for medications, P stands for past medical history, L stands for lost food they intake, lost oral what they intake. E stand for event that had aggravated the present condition, that has to be mentioned here. So this is a focused history collection. So nurse has to ask for what is the signs and symptoms present the patient got admitted in casualty. Whether they have any allergic to the medication, redness, rashes, or any insect bite, because of that they had allergy, food allergy, medication allergy, all such thing. M stand for medication, what medication they had recently before the symptom had arisen. P stand for past medical history, whether they are on treatment for diabetes, hypertension or CVA, all such things should be, or hyperthyroidism, all such things should be asked from the patient. What is the last oral intake? Maybe they would have gone out, taken the food that may be aggravated the symptom like diarrhea, vomiting, and abdominal pain. What is the event that had aggravated the condition? For example, when the patient says that when I lifted a pot of water, the patient had developed chest pain immediately and developed chest pain, could not able to move there, move further with the lifting of that heavy weight. All such things should be asked from the patient. And next one is the medical history. What is the present medical history we need to concentrate? OPQRST. O stands for onset of the symptom. P stands for patient activity at at the time of symptom arised. Q stand for quality of the symptom. For example, if you say that is the pain the patient is coming from with the chest pain, what is the quality? How they rate the pain? Out of 10, they rate the 8 or 5 is a moderate pain, 8 is a severe pain. How they rate? And the quality is stabbing pain, pricking pain, radiating to the left hand or back or right hand. What is the quality? All such thing should be mentioned in the history. R stands for radiating pain, and S stand for severity. As I mentioned, how severe. So I already mentioned each individual is unique. The pain of perception of mind will be severe. When I ask this, when other patient says that may be moderate or mild. So that is why it is a unique problem. So try to understand the thing, the severity and time. What is the duration of the symptom? These things should be asked from the patient. So sample should be asked when the patient comes to you, as well as OPQRST, onset of symptom, patient activity at the time of symptom, quality of the symptom, radiating, yes, severity, team for time. These things should be concentrated when we assess the focused history from the patient. So this is what they expect. When we write the health history of focus as a nurse practitioner, you will be posted in the clinical area, especially in the intensive care unit. You need to focus on these two acronyms of sample and PQRSTU so that you could collect the relevant data and plan your nursing care accordingly. Hope you understand the concept of collecting the general history, I mean to say focused, as well as the comprehensive health history. If any doubts could be clarified at any time. Thank you.